right now is Dr. Lilian Abo. She is the Chief of Infection Prevention at Jackson Health System in Miami. You're on the front lines in Florida, Dr. Abo. The CDC now says your state is seeing the highest number of the new variants of any state. So what have you been experiencing there?
Hi, good afternoon. What we have been seeing is a steady increase in the number of COVID variants across Miami-Dade County and the state of Florida. We're sort of the United Nations of the COVID variants, and we're not only seeing the B.1.1.7, which is the UK variant, but there are other variants of concern that continue to increase. What this means for us is high risk of transmission, and if people are not wearing masks and engaging in low-risk behaviors, if people are taking high-risk behaviors and partying, we're seeing an increased number of transmissions, infections, and hospitalizations.
And then adding to the health officials' concerns about these variants, a likely shortage in the Johnson & Johnson vaccine supply is now upon us. Next week, the number of shots allocated by the federal government is expected to fall by 84% because of a manufacturing delay. So how much of an obstacle will that be for people in your area?
Well, I think it's a barrier. But we have learned with this pandemic that you have to be nimble and you have to adapt rapidly. So we're very fortunate to still have Moderna and Pfizer vaccines. And what I have been telling people all along, this is not the time to choose, I want this vaccine for convenience. This is the time to get vaccinated no matter what. We're in the northern side of the hemisphere. We're in the US. We need to be brave and bold, and we need to get vaccinated. Yes, Johnson is 1 dose, but we have Moderna and Pfizer are 2 doses with 90% efficacy. Go and get vaccinated.
And while there's some hope on the horizon with the potential availability of vaccines to young people, there's also the concern as it pertains to young people. Particularly the CDC is saying that children may be spreading it through after-school activities like sports. And Florida saw an outbreak after a high school wrestling tournament in December. So, you know, as schools try to reopen, what is your thought process on the after-school sports activities? I mean, boy, these kids really need their outlets, but now when we hear about the CDC report, what are people to do? How are schools to plan?
A great question. As a physician and the mother of 2 teenagers, we all need that mental health release. Most kids are getting infected in the social activities engaged in those sports. So they also do pizza parties and they all get together in one house and they're all driving, and mom is doing carpooling in the same car with unmasked children. So it's not just the sport itself. I think people need to focus on what are the other social behaviors that come around playing those sports and competitions and driving 10 kids in a car all over the city. So I would encourage people to continue wearing your mask. If you're driving multiple kids in your car, lower the windows, do not recirculate the air conditioning, minimize the pizza parties and the social engagements, go get your sports activities, but try to really limit the potential transmission. These are highly transmissible variants, and our kids are still, those under the age of 16 are still not vaccinated. So we all as parents need to be responsible.
You break it down in a very common sense way. Dr. Lilian Abo, thank you so much out of Miami. I appreciate it.